Although my title is MS Nurse, essentially it's the whole person that we are talking about.
We are the voice for the patient, the advocate for the patient. We will often be the recipient of information that they won't feel comfortable to disclose to anybody else, and that can be a very privileged role that we play. I think the information, education and support that we provide at that time of diagnosis is absolutely critical, and I think can arguably change the trajectory of their disease.
Hi, my name's Ruth Stross. I work as Head of Nursing for Neurology Academy and also as a multiple sclerosis specialist nurse in Surrey in England.
Hi, my name is Belinda Bardsley. I'm the N-CRESS nurse manager. N-CRESS is the Neuro-Immunology service at Austin Health in Melbourne, Australia.
And I'm Brett Drummond. You're listening to the ECTRIMS podcast, the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. When a person gets diagnosed with MS, there are a lot of people that they lean on for support and information. Family, friends, their neurologist, MS organisations and peer support groups. As well as those valuable sources of comfort, there is another group of individuals that play a critical role, not only during the early stages after diagnosis, but throughout the patient's life. MS nurses. At MS Milan 2023, 2 sessions were held focusing on MS nurses, the faces of MS nursing, and pregnancy in MS and the supporting role of MS nurses. In today's episode, my guests, Belinda and Ruth, both MS nurses, are going to talk about how the role of MS nurses is changing and the challenges that they face on a daily basis, as well as sharing their highlights from these sessions at MS Milan 2023. Belinda and Ruth, thanks for joining me.
Thank you.
So, as MS nurses, can you give us a bit more of insight into what your role involves and explain why it's important for you to be attending MS Milan 2023?
I think our role is a crucial role throughout the sort of journey that people who are diagnosed with MS face. I think it's of particular importance at the time of diagnosis when it can be quite an uncertain and sometimes quite frightening sort of time for people. I think the information, education and support that we provide at that time of diagnosis is absolutely critical, and I think can arguably change the trajectory of their disease. I think for people who are not well informed at that time of diagnosis and don't know about sort of, for example, when to act on new symptoms, it can be absolutely devastating if they're not properly informed and well supported. So I think the input of an MS nurse at that point, and then at all the crucial milestone moments thereafter, is absolutely critically important. And perhaps later on we'll speak about the MS Nurse Care Report, which has sort of identified the value and the very important role that we play in improving health outcomes for patients who do have access to an MS nurse.
Yeah, absolutely. I completely agree with you, Belinda. And one of the things that I've found it's been really interesting is the discussions around the role of the MS nurse and how actually, although we work in opposite sides of the world, the role is very, very similar and the issues that we're having are very similar. So I think one of the key things that I took out of the first session was we need to be very careful to look at the value that is behind the nursing role and why that needs to be a nurse and what is it that we actually bring into the post. Because I think one of the things they discussed was a lot of issues around recruitment and retention and kind of how we manage that. How do we bring people into the workforce when MS nurses have been around for a particular length of time and that first cohort of MS nurses are retiring? So there is a bit of a gap, isn't there? Would you agree?
Absolutely. Yeah, they spoke about, in the first nurses session, was an incredibly valuable session, and they did speak about the worldwide shortage of nurses in general, but the fact that that's no different in the MS nursing population, and that we are an ageing population of nurses, myself included, and that we need to ensure that we can entice nurses to the role and retain them once we have them, support and educate them as well once they're there.
Yeah, and also the value of collaboration. So you talked about the MS Nurse Report. We're looking at trying to sort of, do something similar in the UK and Ireland. I think one of the things that we were saying yesterday is, what we don't want to be doing is duplicating work. And I think it's busy, it's struggle within our services. There's, huge capacity issues, huge staffing issues. If work is being done, these sessions that we have here are really important. So the room was full, both sessions, wasn't it? And that felt quite powerful, I have to say. There was a lot of engagement, a lot of conversation going on around the room, which was really good. I mean, last year at ECTRIMS there was one session, so this was 100% improvement, and hopefully next year we'll see more.
Yes, we'd love to see more nurses sessions at ECTRIMS. It's amazing to be here. It's such an incredible atmosphere here. There are, 9,000 people here, I think, at ECTRIMS, a vast array of sessions, but it would be brilliant to see, I guess, nurses better represented and more nursing sessions here.
Well, I mean, you mentioned the nurses' report, and I guess it really clearly identified how critical MS nurses are, and probably a driving factor behind why we are seeing, an extra session at this year's meeting and hopefully more at future meetings. I guess for people listening that may not be aware of what that report was and what it showed, can you maybe start just by giving us a little insight into what that was?
Yeah, sure. So this can be found on MS Australia's website. If you Google MS Nurse Care Report in Australia, it will come up very easily, can be located quite easily. There's an executive summary, or there's quite a detailed report that can be found there. We surveyed around 1,400 participants who all were representative, all have MS, and all representative of the population of people with MS in that they were a cohort of people with MS who sit on the AMSLS, which is the Australian MS longitudinal study. And they responded to a survey which asked them basically what they felt the value of the MS nurse role was, and what it meant to them in terms of sort of outcomes. So it looked at a range of symptoms and other health sort of outcome factors. And it identified, however, that around a third of participants did not have access to MS nurses. And furthermore, there was a significant proportion that were not even aware of the existence of the MS nurse. Which was a major concern to us, I guess. Obviously, the concern that our role is not well understood and not even sort of known about is of great concern. So the report identified 4 recommendations. One was obviously to the importance of raising awareness of the MS nurse role. 2 was to support the existing workforce of MS nurses. 3 was to increase the numbers of MS nurses. And 4 was to increase access to MS nurses. And I think the data that we uncovered in this MS Nurse report, I think is absolutely able to be extended to a global audience. I think it's quite evident. We felt that it was very likely that MS nurses made an economic contribution as well in terms of the fact that we often help patients avoid unnecessary hospitalisations or unnecessary presentation to EDs. We often streamline their transit through to clinic and often avoid the need for them to see a more expensive health practitioner, because often we can sort of, respond to their questions or concerns over the phone, and we can help, support them with side effects or symptoms, avoiding the need for them to be managed otherwise. And so the investment of $5 million to find 50 new MS nurses in Australia would conservatively save $64 million per annum. So, really remarkable sort of findings from in that MS Nurse Care report. So we're working hard on those recommendations in Australia.
Would you say actually within nursing, nurses are often quite innovative? So we have come up with really good ideas on how to make those savings. So the start is with the report, and now it's the next part is the work to get the funding, but also to kind of use that to support other countries, to look at how we work better. And I do think there's a lot
Absolutely.
of what's happening that we need to be sharing.
Definitely. And I think the other real strength that nurses have is that we are excellent communicators. I mean, I think nurses need to be excellent communicators to work most effectively with our patients, but that can be extended to their colleagues as well. So we're very collegial, we're very collaborative, we're very good networkers. And I think that's another amazing aspect of being at ECTRIMS, is to be able to meet colleagues like you, Ruth, and other people that I've only been able to sort of meet with online or via email, and be able to actually sort of get our heads together and think about really innovative ways of working together and ensuring we can improve health outcomes for our patients globally, which is so important.
And I guess in terms of raising awareness, you mentioned in the report that's largely talking about patients and patients being aware of MS nurses and the role that they play. But I guess at a conference like MS Milan. It's also about raising awareness to other MS healthcare professionals who may not necessarily have MS nurses in the place that they work, and also researchers because of the vast array of insights that MS nurses bring and the access to potential data that they can help put towards research projects. Is that another benefit of having nursing sessions at a conference like this, is also raising awareness in the MS professional community?
So yeah, actually that was one of the conversations we had yesterday. So there's two parts for that for me. So there's partly the benefit of having nurse sessions where we can all be in one room. And some of the conversations I've had have really identified that a lot of nurses working in other countries don't have the same setup as we do in the UK. And I would say that disparity is probably across the UK. I think historically it was quite paternalistic within some of our services, but now we work as, with colleagues as peers rather than having a structure. And I know that isn't the same in other countries. So I've been speaking to colleagues working in other areas across Europe, and that's very different. So for me, it's partly having the nurse sessions, but I think one of the things that you touched on earlier, Belinda, which I think would be really important to see, is that we actually have nurses in other sessions. So we have nurses in sort of, in any of the scientific sessions, or so that for us, it would be really interesting to see that kind of more rounded discussion from a multidisciplinary viewpoint.
I completely agree. Having a nurse representative within some of those neurological or scientific sessions would be fantastic. So it is more of a multidisciplinary sort of flavour, and so that we can absolutely spread that message of the important role that we play, in our clinics and in our patient care. Absolutely.
One of the things we were saying is that the room was full of nurses, which was exciting, talking about the value of the MS nurse, but you're preaching to the converted to a certain extent. Whereas it would be good if the room was full of other colleagues, so then they could actually hear and understand what it is we do.
And the challenge is that because there are so many concurrent sessions, that yes, you're right, the nurses will flow into the nurses' sessions, but the neurologists and scientists and academics will be at the other sessions at that time.
So there's choice.
It would be lovely to embed nurses within some of those other sessions as well, and have representation at those.
Yeah. Well, I think because MS nurses occupy quite a unique space. I know when we talk about research, we say that researchers understand MS at a really good level from the specific area that they focus on. Obviously, people living with MS, no one understands MS better than them because they have that. But MS nurses almost bridge those two because they have the understanding of MS, but also they have the closest insights into that lived experience as possible because of how much time they spend interacting with people living with MS. And so getting that input and insight across all of those different sessions, I think is really invaluable, and no one else almost can provide it.
I completely agree, and often we are the voice for the patient, the advocate for the patient. We will often be the recipient of information that they won't feel comfortable to disclose to anybody else, and that can be a very privileged role that we play. There can be very distressing information that they pass on to us about, family violence or sexually transmitted infections, or very sensitive information about miscarriage, all kinds of things that very distressing for them to report. And I just often find too that at time of diagnosis, I so often see people really struggling to keep it together in their consultation with the neurologist. But I take them away into my room and say, how are you getting on? How are you really feeling? And the tears they allow to roll freely down their cheeks when they're in the room in the safe place with the MS nurse. And again, I just think this is such a privileged role. This is actually what I love about my role. I just love it. And I'm sure you feel the same, Ruth. I mean, it's never nice to see someone distressed. I don't mean that. But the fact that they feel comfortable in disclosing their most secret feelings and thoughts and their most intimate moments with us is a really special thing, isn't it, Ruth?
So I completely agree. And I've been finding since COVID, especially when patients are coming back into clinic, there's been a lot of tears. So about 70% of people coming in have been quite tearful towards the end of the appointment. A lot of the kind of isolation and issues that they've been describing. And as you say, some of the things that are disclosed in clinic are really traumatic. And I think one of the things, although my title is MS nurse, essentially it's the whole person that we are talking about. So I've had disclosures of domestic abuse as a child, and I'm talking to someone in their late 50s, and they'd say that they've never mentioned it to anybody in that whole time. They've held on to it. And so then it's referrals on to support for, some PTSD. And so for me, it was a learning curve to find these services that were available. But it wasn't that she disclosed it and it was like, okay, what do I do next? As a nurse within this role, my job is to support her through that, because the impact of holding on to that kind of, that experience was affecting her MS. But essentially, that's what we do, isn't it? It's looking after the whole person.
Yes, we've had a number of those sorts of disclosures recently, and they're very confronting and challenging, but again, such a privileged thing to have to sort of respond to and provide support for. It's just, yeah.
One of the things from yesterday that I found quite interesting was when Jeffrey spoke. Predominantly, I think MS nurses internationally are women. So he was talking around the role of the male nurse in nursing and then within MS nursing. And it was quite interesting because he said there aren't really resources available. He was talking about really tricky conversations with patients, people choosing not to be seen by him. But I was really moved by the way that he handled those conversations, and there wasn't any element at all of upset or kind of the impact really on him. He was talking around actually wanting to support these people, and he would refer to a colleague and say, if you feel like you want to talk to me at a later date, then that was, that availability was still there. There wasn't any change in the service. But it was really interesting because I don't think I've really thought through, how difficult it is for men working in MS.
Yes, and like you said, not taking it personally, just accepting the patient's wishes and yeah.
Obviously, we've really clearly shown the value of MS nurses and how critical a role they play. Are there any other highlights from the conference that you'd like to share from any of the other presentations that you saw?
There was something I wanted to speak about, which was something that Ruth raised, but it's more about a trend that has been noticed certainly in the UK and in other regions of the world. And I think it's really important to talk about because it impacts on MS nurses quite dramatically. And it's a trend towards implementing other professions within what has traditionally been an MS nurse role. And I wonder if you could speak a bit about that, Ruth, because that concerns me.
So one of the things that we've been finding across the UK is there's been difficulty with recruitment and retention, which was highlighted through the talk yesterday. And I think what we may have lost a little bit of is what is the value of that role being a nurse. So if an MS nurse leaves the post and they're unable to recruit, and partly that is who they're going out to look to recruit, the role is changed into more of a practitioner role, and then it's opened up to other colleagues. And I guess from my point of view, I love, and I think it's really exciting that we are changing, that the whole of the setup of the MS multidisciplinary team is exploding, and there's new roles. We have the MS coordinator, the MS practitioner, and I think it's really good. But I think what we're losing is what is the value of each of those people within that role, and that's what we need to be looking at. What are the skill set of those people? So if you have a role that is essentially a nursing role, what is happening when you change that into a practitioner, or what is being lost, what may be being gained? But that needs to be identified, it needs to be clearly understood before that change happens. And it always needs to be service-led, so it needs to be what's happening within that service at that time, and is this needed?
And I think in Australia I've spoken about positions where MS nurses are unable to secure, permanent long-term positions because they're employed on fixed-term or short-term or soft-funded positions. That can make it difficult for them to have a sense of permanency in a role, sometimes to get a mortgage. And we're also often faced with nurses who are employed on, very few hours, but are responsible for looking after, cohorts of patients that are, 650 patients or 850 patients, and they're only there for a couple of days a week. And they're, feeling incredibly overwhelmed and stressed by those sorts of, impossible numbers to manage, or they're working, huge hours, handing out their mobile number, which is, again, I would not recommend.
No.
I think this is probably very likely a global problem, and I think It's something that together in a forum like this, it's possible to get our heads together and try and tackle some of these similar issues.
Well, it's interesting because we talk about boundaries within roles, and I do think some of my colleagues are potentially better at that, but I think that's really difficult for the nursing role, because where do you put those boundaries? But one of the things you just asked, Brett, actually was around what session did I find was quite, and back to the innovation within nursing. Daisy Cam presented a really good example of a service that they run in Sheffield, which has been going for probably a couple of years. They've been nominated and they've won awards nationally, and it's a pregnancy, so it's a preconception and pregnancy clinic, and it brings different multidisciplinary professionals into one clinic. So the obstetrician, they have a midwife, they have an MS neurologist and an MS nurse. And what she showed on one slide was that there were literally one patient had been referred to and onto about 20 people, and all of that was eliminated because they were in one room and she saw them, and that support, and the feedback from the particular patient was that just having that support was amazing, and her whole journey was a lot less stressful. So I think it's such an emotional time for a woman, especially with the preconception and then going through the pregnancy, which is exciting, but obviously trying to juggle MS and potentially other family and things like that. Just having all that expertise and there for them to talk to was really key. So that was a really lovely example, wasn't it, of kind of innovation within nursing.
It's lovely to hear about those sorts of projects and approaches to care.
Incredible insights obviously coming out of the conference. I guess the key role here is obviously helping people living with MS. So I guess just to finish off, can you both just share some thoughts around what you think the key takeaway messages from this meeting are for people living with MS, in terms of what sort of things they may see in terms of the biggest influence of care that may come back to them from conversations that have happened here at the meeting?
We haven't spoken about it in this discussion so far, but there is quite an emphasis in the agenda on the program on biomarkers, and so the importance and the emerging role of biomarkers on influencing the management of care. And I've just come from a session which was exploring that, and I think that will be a very interesting sort of way of managing care and influencing the way that we approach care in the future. So doing, for example, serum neurofilament sort of chain testing in conjunction with MRI and clinical assessment of patients to identify when there might be a requirement to escalate treatment or change treatment or identify progression. I think that's going to be really interesting. So watch this space. I think that's going to be very interesting.
So I've had some really interesting meetings looking at policy in MS across the UK. So very much, I guess a lot of conversations with colleagues is wanting to shift the attitude towards MS into more of the arena around how we manage oncology and cardiology, so that actually rather than having a kind of a reactive to issue attitude, that we're actually proactively managing people. So I've been catching up with Klaus Schmierer talking about attack MS, and as you were asking from what take-home messages for people with MS, I guess for me it's reaching out and supporting each other. There's so many charities that are based here that have attended. So MS Together is quite a new charity in the UK, the MS Trust, and I just think it's really good to know that actually there is that support for people. And one of the things that we've been discussing is really encouraging patients to contact in the UK their integrated care boards. So that's just kind of, they need to be getting in touch with commissioners, with people that influence policy, because I think some of the experiences that they are having are not good. Some are, and both need to be reflected back. So that really helps support, rather than, I think sometimes sitting with it is really difficult for people, and they really want to share it. So if they feel they are able, then reach out, maybe go through the charities for this. But I do think it's really important for that experience to be fed back. And the other take-home message, I guess, is it would be lovely to see more nurses involved next year.
Yes,
definitely.
Yeah.
Well, thank you, Ruth and Belinda, both for your tireless efforts to help people living with multiple sclerosis and the support you provide, and also for participating in our podcast today.
Pleasure.
Thank you very much.
And thanks everyone for listening. Once again, I'm Brett Drummond, host of this podcast episode. I'm also co-founder of MS Translate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community. The ACTRIMS podcast is produced and hosted in collaboration with two key partners, MS Translate, and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The ECTRIMS podcast is supported by an educational grant from Novartis, Roche, and Alexion AstraZeneca Rare Disease. Educational grant providers have no input on the podcast series content. You can read more about the topic of this latest podcast episode and more on the ECTRIMS website, ectrims.eu. Do subscribe to the ECTRIMS podcast on your favourite podcast channels and follow ECTRIMS on Twitter, LinkedIn, Facebook, and YouTube.